Hi, it's Dr. Terry Crump coming to you from Crump Wellness Services. Just wanted to hop on and talk a little bit about what to expect in therapy. There's been more conversation about our mental health, and some of you may not really have an experience of coming to therapy, and you may have questions about what should I expect if I do come to a therapy session. So there are just a few points that I want to talk about. First of all, you should expect conversation. Really simple. Conversation. It's just someone like myself, a mental health clinician, and you talking about the things that concern you. There's nothing magical necessarily about that conversation. You would be surprised, though, if you engage in the conversation with a mental health professional of your choosing, that there are some things that are going to be clarified in that conversation. Why? Because that mental health professional, that clinician, is going to engage in the second point I wanted to make. They're going to be curious about you, curious about your concerns and what's bringing you in to talk with them about that time. They're going to ask a series of questions, so it's important for you to share what's on your mind. It's important for you to disclose what's been going on in your head and in your life. And you're going to do that at a rate and a pace that feels comfortable for you. But that professional is going to express curiosity in you, asking about your past, asking about your present. They're going to be pretty comprehensive in the topics that they cover, various areas of your life. They will be very curious so that they're getting a full picture about what's going on. What you should also expect from therapy is compassion. You should expect to feel a connection with the individual. The connection suggests that that person cares about you genuinely. They're not just faking it. That there's some level of caring about you even if they just met you, and that they're compassionate, that they understand, they have some level of understanding of you, your situation, and your circumstance. And lastly, I would say you should expect collaboration. This is not a situation where you come in and there's some magical cure. At least in my office, I tell them, I'm not going to cure you, but together, you and I can figure out what are some ways that we can tackle this thing, those things that are concerning to you. Yes, I'm pretty learned and I study a lot and I do a lot of reading and I have ideas about things that can be helpful to you, helpful in contributing towards your healing, but there's not a magical cure per se. I hope that's been helpful, and I'm happy to talk more with you about what to expect in therapy, so feel free to reach out. Thanks for listening. Dr. Crump from Crump Wellness Services. Be well.